Hello, my name is Michelle Morand. I am co-founder of Cancer Treatment Options and Management. We are a worldwide, independent medical science research and advocacy service, helping to link cancer patients and their oncologists with the most current advancements in medical science. Precision oncology is what it's called. Perhaps you've heard of it, or perhaps you've heard of oncogenomics or personalized cancer care. This field of cancer care is so new, the industry hasn't yet settled on a name, but either one of those things fits. We want to make sure you get the most personalized cancer care. We want to make sure you use genomic testing to identify the best treatments for you. And we're going to make sure that your diagnosis and your treatment plan are as precisely targeted to what is causing your cancer and what your body needs as possible. This approach to cancer care has been proven over the last decade to provide cancer patients with significantly longer lifespans with fewer treatment side effects. It is the evolution of cancer care, and I'm here today to tell you a little bit more about it. We're going to talk about the 7 crucial things you can do now to beat cancer. With precision oncology, you have less stress and more time, and that's what it's all about. Time is of the essence with cancer. So starting with precision oncology right away is the ideal scenario. But even if you're stage 4 or you've been told that there's nothing more that can be done for you, we've still helped people over the last 10 years to come to full remission in those states. So never give up, never surrender. Do not assume there's no more that can be done until you've used every element of precision oncology. I'm going to tell you what those elements are. I'm going to tell you how to get access for them and how to advocate for yourself with your oncologist. So you don't have to change doctors and you don't have to travel and you get better care. Sound too good to be true? Well, it's what I've been doing for cancer patients around the world for the last decade, and I'm going to help you figure out how to do it too. So listen on. When you receive a diagnosis of cancer, the goals that you want to accomplish in your life will come into sharper focus, and you'll naturally wonder how many of those bucket list items you're going to get to experience. One thing will be abundantly clear. You'll want to make sure that you do everything you can to experience every single one. We can help you make sure those dreams come true. A cancer diagnosis makes everything feel more urgent, and that's a good thing. Because in fact, the scientific evidence is clear. The more rapidly you get access to precision oncology, the better your prognosis. The more information your doctor has on exactly where the cancer is in your body and what is causing your cancer to grow, and which treatments will be best for you and the unique mutations that caused your cancer, the more successfully your oncologist can treat you. So don't wait and don't wonder if you're getting the best care. What happened? How did you get cancer? Cancer is a disease of mutated DNA. It's really that simple. What's happened to lead to cancer in your body is that you were either born with certain mutations or certain mutations developed through your lifespan due to environmental toxins or lifestyle choices, or a combination of the two, that have now culminated in enough mutations in your DNA that the natural anti-cancer pathways that exist in your body can no longer keep cancer at bay. To understand the importance of the use of precision oncology in your cancer diagnosis and in the outcome of your cancer treatment, it's necessary to understand the basics of DNA and how genetic mutations occur in the first place. DNA, which stands for deoxyribonucleic acid, is a chain of chemical bases that attach together and act as a program code that defines how every cell in your body is supposed to function. The code is composed of 4 different chemical bases, referred to as nucleotides. They are abbreviated as A, T, G, and C, and they are complementary to each other. This means that the chemical base A can bond with chemical base T, and nucleotide G can pair up with C. This allows the DNA code to exist as two distinct strands and gives DNA its double helix structure, as well as stability and important biological functions. The DNA code that cells use to function is very large, consisting of over 6 billion nucleotides, collectively referred to as your genome. This is tightly packed into structures called chromosomes. In total, all cells with a nucleus, a compartment that houses DNA within the cell, contain 46 chromosomes, with the exception of reproductive cells. Of the 46 chromosomes, 23 have been inherited from your mother and 23 have been inherited from your father. This is why reproductive cells only have 23 chromosomes each, allowing for the unification of genetic code from each parent during fertilization. Of the 46 chromosomes, 2 are referred to as sex chromosomes. They're labeled as X or Y. Males always have the XY chromosomes, and the Y chromosomes can only be inherited from a father. Females have XX chromosomes. The other remaining 44 chromosomes are pairs of 22 non-sex chromosomes and can vary substantially in size from one another. This means you should have 2 copies of chromosome 1, one of each inherited from both of your parents, 2 pairs of chromosome 2, and so on. Your DNA and cell division regulation. Your DNA code contains information on how to produce functional molecules that work and perform important tasks within your cells. Your DNA also contains information on how this production should be regulated. Together, the interplay between the code and the biological molecules within the cell govern how a cell will function and behave for the entire lifespan of that cell. The function within the cell that has to occur, or any interaction of the cell with its outside environment, will ultimately be determined by the information encoded in its DNA. Among other things, this includes cell division. Cell division is a very important and complicated process and has to be tightly regulated by the cell itself. As you can imagine, cell cycle control is also programmed into the DNA. This means that certain corruptions to the DNA code in the form of mutations can disrupt the proper control of cell cycle division. And if enough damaging mutations accumulate in any particular cell, this can eventually lead to an uncontrolled state of cellular division that leads to cancer. In this way, cancer can be defined as a disease of mutated DNA. Because cell cycle and other biological events required for cancer development are such complex processes, there are also many ways of affecting these processes. Consequently, there are many ways that cancer can be created with mutated DNA. This is why cancer type is not determined merely by the tissue of origin or the location in your body, but now cancer type is determined by what mutation pattern is present behind the origin of your cancer. Hereditary cancers. This also helps explain why some cancers might appear to be hereditary and run in the family, while others only appear spontaneously. For hereditary cancers, some mutations that predispose individuals to cancers are passed on from generation to generation. These inherited mutations on their own typically won't produce cancer, but they can act as contributing factors to future problems. They make you more susceptible to other carcinogens in the environment. If certain other mutations spontaneously arrive through lifestyle or exposure to certain triggers, cancer will appear. This naturally puts you, if you have inherited cancer mutations, at a disadvantage compared to a person without such mutations. Because affected individuals need fewer lifestyle mutations or mutation events throughout their lifetimes to initiate cancer development. A healthy individual without inherited predisposing mutations will then require more random mutations to develop cancer. Screening for possible hereditary cancers is one of the very best ways that you can arm yourself with the information and lifestyle changes you need to reduce the likelihood of developing cancer. What is precision oncology? Precision oncology is an evidence-based, innovative approach to cancer treatment that is greatly increasing the life expectancy and recovery rates of cancer patients worldwide. Oncology journals and associations worldwide refer to precision oncology as the evolution of cancer care. Precision oncology is rooted in the scientific proof that every person's cancer is comprised of a unique combination of genetically inherited mutations coupled with cell mutations that have arisen as a result of lifestyle choices, personal history, or environmental factors. This means your cancer is literally unique to you, and it must be treated that way. Precision oncology begins with diagnostic tests that reveal the precise location of tumors in your body and the unique combinations of mutations that are causing your cancer to grow. Then, detailed personalized research is conducted to identify the treatments that medical science shows will provide the greatest benefit to you. The precision oncology approach to cancer generates a more rapid and successful response to treatment while greatly reducing the number and severity of side effects and creating a greater likelihood of longer progression-free and overall survival rates and a lower chance of cancer recurrence. The key to precision oncology, the 4 pillars. Precision oncology has 4 distinct steps, also referred to as the 4 pillars of precision oncology. Research shows that when cancer patients include just one aspect of these precision oncology tools, the results for them are longer survival rates with greatly reduced treatment side effects. When all 4 pillars of precision oncology are applied, the results are even better survival rates with even fewer treatment-related side effects and less likelihood of recurrence. Therefore, ensuring that your treatment team is using each of these steps in your cancer care is the very best way for you to know you're getting the very best care that the world has to offer. The 4 pillars of precision oncology are precise diagnosis, personalized research, advanced and targeted treatment options, including immunotherapies, and ongoing treatment monitoring using PET-CT scans and exosome-based liquid biopsies. That might all sound like Greek to you, but I'm going to walk you through what each one of those things means and how to make sure that you get it for your cancer treatment. PET-CT imaging versus CT scans. PET-CT gives you more accurate staging, more accurate surgery, and more beneficial treatments, and allows for more accurate treatment monitoring. In essence, it just gives you more confidence and gives your oncologist more to work with from the very start to the very end of your cancer treatment. How does PET-CT work? Well, in PET-CT scans, you get a clear image of what's happening inside your body in a way that X-rays and CT scans and MRIs alone just simply can't provide. For a PET-CT scan, patients are injected with a radioactive glucose solution. Cancer cells utilize large amounts of glucose for their rapid growth. So active tumors quickly uptake a significant amount of this solution, and they begin to glow when they're imaged. In this way, the exact size, location, and aggressiveness of your tumors can easily be identified. If you have already received chemotherapy or radiation treatment, or even targeted therapies, a basic CT or MRI scan may show that there are still some dark masses remaining. However, these may not in fact be active cancer. In fact, oftentimes, these masses are scar tissue or dead cancer cells. A PET-CT scan can tell you and your oncologist whether these masses are in fact signs that your cancer treatment is not working and therefore you still have active cancer, or of scar tissue from dead cancer cells. This means you don't need to worry needlessly about how well your cancer treatment is working, and you don't need to continue unnecessary or ineffective treatments. No time is wasted. If a PET-CT scan has not been provided for you or has not been conducted recently, and you want to ensure that you know where your cancer is and whether your treatment is having the desired effect, we highly recommend that you have a PET-CT scan as soon as possible. Genetic testing for targeted and immunotherapy options. First, let's talk about genetic testing panels, what they are and why you need them. There are two key forms of tests that we perform on your blood or tumor tissue to aid us in the development of the most precise treatment plan for you. We do germline mutations testing and somatic mutations testing. Germline mutations testing detects hereditary or inherited alterations in your DNA, as we talked about before. Somatic mutations testing detects acquired alterations in DNA, changes that have happened since you've been born through exposure to environmental toxins, for example. Acquired alterations are responsible for the majority of cancers. However, we have found that 80% of our patients have inherited mutations as well as somatic mutations. So testing for both really is crucial. To provide you with the best possible treatment options, detailed tests are conducted using a sample of your tumor tissue or a blood sample. These are carefully analyzed to determine the mutations in genes that are involved in your cancer. These tests are capable of identifying hundreds of known cancer-causing genes, commonly mutated and found in many different types of cancers. And this information, plus our personalized research, tells us what's causing your cancer to grow and what treatments will serve you best. There are also genetic tests that explore inherited mutations, such as BRCA1 or 2, which are commonly found in breast or ovarian cancers. Testing for these mutations allows you to ensure that any targetable inherited mutations are identified for treatment. These genetic tests, coupled with PET-CT scans and our personalized research, provide you and your oncologist with the most accurate diagnosis that medical science can provide you today. And it will give you confidence that you are getting the right treatment at the right time, not too much, not too little, and you'll know when your cancer is truly gone. Genetic testing for targeted cancer therapy. There are two main ways of testing for germline and somatic mutations in cancer. One is tumor tissue DNA sequencing, which tests for hundreds of cancer-causing mutations. In fact, one of our favorite tests these days looks at 650 different related mutations that have targeted therapies for each and every one. This type of test identifies the specific mutations that are driving your cancer, which then allows us to target those mutations with special treatments called targeted therapies. The other form of DNA sequencing test is called a liquid biopsy, also referred to as circulating tumor or ctDNA testing. For tumor DNA sequencing, tissue tumor samples taken during biopsies and often stored for many years, generally at the hospital where your biopsy was performed. These samples can be requisitioned with your permission for further testing, such as tumor DNA sequencing. In this type of testing, a sample of tumor tissue from your biopsy is examined for hundreds of possible cancer-causing germline and somatic mutations. The processing time for this type of test is approximately 3 weeks, and the results of this test provide a very clear picture of the key mutations that have driven your cancer to develop. This then allows expert researchers such as our team at CTOAM to explore all possible targeted therapy options available for you anywhere in the world. Liquid biopsies for diagnosis and treatment monitoring. In this form of genetic test, a sample of your blood is obtained and is then tested for a panel of known mutations to be involved in cancer development. This test is based on the widely accepted science that all cells, including cancer cells, release their DNA into the bloodstream. Unlike the tumor tissue test we talked about earlier, where DNA is isolated from the cells, in liquid biopsy, it is the DNA that is floating directly in your bloodstream, specifically DNA from those cells that have your cancerous mutations, that are isolated and analyzed. For example, if a mutation in the KRAS gene, which plays an important role in cell regulation, is discovered in your biopsy sample, we can look at the amount of this mutation, the percentage of this mutated DNA in your bloodstream, circulating in your blood, both before and after initiating a new targeted therapy. If the amount of this mutation decreases within 3 to 6 weeks since you began treatment, we know right away that your treatment is working with 99.9% certainty. This test can confirm whether or not your treatment is working months before tumors are large enough to detect, even using our favorite imaging technology, PET-CT. And the earlier a tumor is detected, the better your prognosis. Also, sometimes you might not have a tissue biopsy to examine. We can use these ctDNA or liquid biopsy tests to identify causative cancer mutations so you can begin targeted therapy right away. This test often takes 2 weeks, and that means that within 2 weeks, you can have your test results and begin a targeted therapy regimen with confidence that this is the right one for you. And remember what I told you before, targeted therapy allows you to have a longer survival with fewer treatment side effects. So you want to get targeted therapy happening for you in your cancer care as quickly as you possibly can. Personalized research and advocacy. The outcome of your precision oncology tests will be compiled with your medical history and a detailed life history. This information will then be thoroughly examined in combination with any research we can find through online databases, oncology journals, and liaison with our worldwide network of leading researchers and oncologists. It'll be compiled into a brief report outlining our findings of the surgical, dietary, lifestyle, and targeted therapy options that are going to provide you with the greatest possible benefit. This report is presented to you in a consultation with your CTOAM counselor and is also presented to your oncologist with direct consultation on the next steps for treatment. Because of the quality of the data we collect, using only FDA-approved treatments, using only those treatments found and proven to work in clinical medical science journals, your oncologist has the confidence and the information that they need from this data to modify their treatment plan for you and provide you with a treatment that's right for you. As needed, our team will assist in the coordination of your access to your treatment of choice and will stay connected with you every step of the way to ensure that you're getting the fastest access to the best treatments and that your treatment is being properly monitored with those liquid biopsies to allow for rapid adjustments as needed and, most importantly, as much success and peace of mind as possible. When asking your doctor or your insurance company to support an innovative treatment approach, you must be able to provide them with solid scientific data that convincingly argues for something other than standard care. CTOAM will provide you and your treating oncologist with the data you require, and we will advocate as needed on your behalf for whichever treatment the research has shown will provide you the best possible outcome. well over 85% of the time, regardless of the initial treatment plan that was created for you, or even if you've been told there are no more options. When we present our report and the supporting evidence that we have found to accompany it, your oncologist will willingly adjust their approach and work alongside us to help facilitate your access to the treatment you need. Together, we work with your oncologist and your insurance provider to help you access the treatment you need at minimal personal cost to you. More about targeted therapies. What is targeted therapy? Targeted cancer treatments are those that have been designed by medical scientists to target and kill only those cells in your body carrying a specific cancerous mutation. They rapidly eradicate cancer cells and leave your healthy cells untouched. Because these treatments directly attack the cancerous cells in your body while not affecting healthy tissue, targeted therapy treatment proves to be much more successful than conventional chemotherapy or radiation in slowing or stopping the growth of your tumors. In addition, targeted therapies have been shown to provide a significant reduction of treatment side effects, and physical recovery is often more rapid with targeted therapy for these reasons. Once a detailed genetic testing of your cancerous tissue or blood has been conducted to produce verifiable scientific data about what has caused your cancer to grow, we can identify with great confidence the best treatments for you based on targeted cancer therapies. There are hundreds of targetable mutations and hundreds of correlating targeted therapies, all with FDA approval. So even if you've been told there's nothing more that can be done for you, or that you only have the option of standard chemo or radiation, there almost certainly is a targeted therapy option that can help slow the growth of your cancer or even reverse it. Our job is to make sure that you and your oncologist know about it and how to get it. The nutraceutical diet. Slow and even reverse cancer with the right foods and supplements. You can think of nutraceuticals as using certain types of foods or supplements as your own form of targeted therapy. A nutraceutical is a food or nutritional supplement that has been scientifically proven to help slow the growth of cancer and help strengthen your immune system. A nutraceutical diet is a form of targeted cancer therapy, which has been shown to aid in cancer treatment, recovery, and prevention. Medical science has shown that nutraceuticals directly affect the development of cancer in two distinct ways. 1, they suppress cancer-causing genes that would otherwise trigger cancer growth. 2, they directly promote the activity of genes that suppress cancer from developing. This means that just by eating certain foods or ingesting certain supplements, you can have a significant positive impact on how your cancer develops, on your own treatment management, and on the prevention of cancer recurrence. In fact, diet combined with a simple exercise routine has been shown to reduce the development of certain cancers by over 80% alone. Just as traditional chemotherapy and radiation are no longer the best approach to cancer treatment, so is the standard elimination or restrictive diet approach a very outdated and unnecessarily limited approach to using foods to aid in cancer care and prevention. It is quite simple to use foods alongside your targeted therapies to positively influence the outcome of your cancer treatment. But first, you need proper genetic testing. You need to be able to identify which genes are mutated in your cancer, and therefore which foods are most important for you to be consuming and which are most important for you to stay away from. The foods and supplements outlined in your nutraceutical diet that we'll personally design for you have been shown by medical science to directly impact the genes and genetic pathways that are involved in your cancer. Nutraceutical diets are typically quite affordable and easy to execute on a daily basis, making them a great long-term tool for cancer treatment, management, and prevention. For those with a family history of certain hereditary cancers, a nutraceutical diet and structured exercise regime have been shown to greatly reduce the likelihood that cancer will develop. Why aren't more cancer patients on nutraceutical diets? Well, a personalized nutraceutical diet is a simple, affordable way for you to help yourself treat cancer and prevent its recurrence. And yet, many cancer patients are not aware that this option for cancer care exists. This is for the very same reason that so few cancer patients are offered targeted cancer therapies, despite the mounting data showing their benefit. Genetic testing is required in order to identify the nutraceuticals that will serve you best, and genetic testing is not yet part of standard care in most countries. As a result, most cancer patients, as well as most doctors, remain unaware of the impact that nutraceuticals can have on your cancer treatment. Our team will create the perfect nutraceutical diet for you based on your lifestyle and unique genetics. Clinical trials are not experimental treatments. As part of all potential options investigated to treat your cancer, clinical trials should also be investigated as an option for you. At CTOAM, we evaluate all possible treatments that would be beneficial to your specific situation. And should you decide to engage in a clinical trial as part of your cancer treatment, our team will help coordinate your enrollment. What are clinical trials, you ask? Clinical trials are one of the final stages a treatment undergoes before it becomes available to the general public. In order for any treatment to reach the clinical trial stage, it has already been rigorously tested and found to be likely superior to standard care. For ethical reasons, there are no placebos used in cancer clinical trials. Patients either receive standard care as the control group. In this way, the minimum treatment a patient participating in a clinical trial will receive would be standard treatment. Clinical trials offer treatments that have already demonstrated effectiveness over standard care. Additionally, participants are provided with superior imaging, molecular or genetic testing, surgeries, and advanced chemotherapy protocols that are not typically offered in standard medical treatment. Many clinical trials prefer CTOAM clients, as many of the tests that are needed in the trial have already been performed as part of our research on your behalf. As a result, our clients are often fast-tracked into trials and can begin receiving these treatments very quickly. You might be wondering, aren't clinical trials a last resort? Well, actually, with the current approach to cancer treatment, coupled with the high patient load that most oncologists face, many doctors don't have the resources to research and connect their patients with clinical trials. However, clinical trials can be accessed at any stage of your cancer care. Depending on your genetic testing results, it might make sense for you to choose to enroll in a clinical trial at the very beginning of your cancer treatment rather than waiting for a last resort. The testing and care that is provided to clinical trial patients, combined with their demonstrated benefit over standard care, can make clinical trials a very intelligent first step. It doesn't typically cost anything to enroll in a clinical trial, and these days, you often don't even have to travel to be a part of this trial. Once you have the proof through genetic testing and personalized research that this trial is right for you, your oncologist can often become a part of the clinical trial and prescribe and administer these treatments for you. There's so much that can be done in clinical trials and in cancer care in general, and so many evolutions literally every week. It's really important that you question any of the assumptions you might be making about what's possible in cancer care, and that you make sure you get the information that you need. Do you want precision oncology? Based on what you've heard, I sure hope so, because it really makes the most sense. If you'd like our help, Cancer Treatment Options and Management can take care of everything. We can make sure that you and your family are thoroughly educated on all the aspects of precision oncology and what optimal cancer care looks like. We can help you rapidly access private diagnostics, including PET-CT imaging and genetic testing. We'll create a personalized research report that includes information on what is causing your cancer to grow. If we found any heritable mutations that might influence your family as well as your own treatment. A list of targeted therapy options and guidance on how to access them, and medical science journal references for you and your oncologist to explore the data that we've collected for yourselves. We'll provide you with a personalized nutraceutical diet and access to our worldwide network of leading oncologists and specialists. We'll assist as necessary with access to clinical trials. We'll advocate with your oncologist, insurance company, and any pharmaceutical companies to gain you access to the treatment you need most. We provide counseling support services for you and your loved ones. We provide ongoing liquid biopsy monitoring of your treatment progress. We provide ongoing consultations with your personal research team, with your oncologist, and with your family. And we keep an eye on the latest research and make sure we update you on anything new we find. And we guarantee privacy. Your genetic test data and your medical records remain strictly confidential within our Canadian privacy laws, as they're some of the very best in the world. We'll provide you with diagnostic proof of which genes are driving your cancer. We'll use PET-CT imaging to see exactly where the cancer is in your body and which tumors are most aggressive and need to be targeted or surgically removed first. We'll provide a reference summary of our research of all relevant medical options that are showing better results than the standard care treatment you've been offered. We provide the dietary and lifestyle counseling that you need to aid you in your treatment outcome and in the prevention of recurrence. And again, we'll be advocating on your behalf to bring you access to the latest and best evidence-based targeted therapies available, whether already available through your public healthcare oncologist or not. We'll make sure that they help you get access to them and that you can start using these treatments right away. You might be wondering, why isn't precision oncology included in Canadian healthcare if it's so incredibly beneficial? Precision oncology is the natural evolution of science and technology as applied to cancer treatment and prevention. But while these advancements are inevitable and a very beneficial development, precision oncology is still a relatively new branch of medicine. Some hospitals in Canada do currently offer PET-CT scans, but not as a standard diagnostic protocol. You really have to push. Likewise, the genetic tests and targeted treatments that CTOAM recommends are slowly starting to become integrated within the Canadian healthcare system, but often only as a last resort as opposed to a far more beneficial starting place. Doctors working within the Canadian healthcare system have a set number of options that they are permitted to offer you to treat your cancer based on standard treatment protocols and an allocated cost per patient. Once those standard treatments are exhausted, doctors have no more options to offer their patients. This does not in any way mean that there are no more options for you. We have found that the vast majority of Canadian oncologists are highly supportive of any evidence-based options that are presented to them in the pursuit of the best care for their patients. Current research into Canadian healthcare shows that full integration of personal oncogenomics may take anywhere from 10 or more years. And unfortunately, most cancer patients can't wait that long. The drugs identified to target your cancer genes are often already used within the Canadian system to treat other types of cancers or even other illnesses entirely. With your personalized oncogenomic information provided by CTOAM, your doctor can often prescribe these for you without you having to pay for them or to travel for treatment. It's not recommended that you wait until you've been told that there's nothing else that can be done for you before accessing precision oncology technologies. Precision oncology is simply the best line of defense, and outcomes are so much better when precision oncology guides your treatment from the beginning rather than being added as a very last resort. However, even in these cases where patients have come to us well into stage 4 and have been told to prepare for palliative care and get their affairs in order, we have still often been able to find innovations in treatment that their doctors would prescribe for them that gave them more quality time with fewer treatment-related side effects. And in numerous cases, those patients are still alive many years later and cancer-free. Treatments guided by tumor DNA sequencing have been clinically proven to result in longer cancer-free times, longer progression-free survival, improved overall survival, fewer hospital visits, fewer side effects, and overall better health. However, when targeted treatment is delayed, the chances of improved outcomes are reduced as your cancer has time to spread and new mutations can evolve. If you think of it this way, a prescription without a proper diagnosis is the definition of malpractice. So even if there are literally hundreds of targeted therapies out there, if your oncologist can't provide you with the genetic testing data and the personalized research to prove that those treatments are right for you, they simply can't ethically prescribe them for you. But once you take it upon yourself to collect this information, your oncologist has so many more options to provide you. It's really that simple. How long does it take to get your personalized treatment plan and start getting the right treatment? When you engage our precision oncology team, within just a few days, you could have obtained a PET CT scan that can be utilized by your surgeon and your oncologist for more precise treatment. Within 1 week, you could have genetic testing data back to begin to receive targeted therapy options. Within 3 weeks, you'll have all the genetic testing data back and be able to access the most effective targeted therapies for you. This means that within just 3 to 4 weeks of first contacting CTOAM, you and your oncologist will have the most precise and detailed data available on what is causing your cancer to grow and what you can do about it, and when and how you can access those beneficial treatments. Within 3 to 6 weeks after beginning a recommended treatment, you'll have further proof in the form of genetic data from a liquid biopsy blood test as to how well that treatment is working. This approach to cancer care allows for the most rapid approach to modifying your treatment plan as well as giving you true peace of mind. The importance of a second opinion. The American Society of Clinical Oncology, also known as ASCO, along with the Canadian Association of Medical Oncologists and government cancer agencies all around the world, speak to the importance of a second opinion, and they actively encourage patients on their websites to get a second opinion anytime in their diagnosis or treatment. They further encourage doctors to support their clients on this path so that the best possible outcome can be reached and the patient can have the utmost confidence in their treatment decision. These agencies and clinics state that the benefits of you obtaining a second opinion for your cancer care include confirmation or correction of your original diagnosis, additional details about the type of cancer and stage, such as a description of where your cancer is located, more information about whether your cancer has spread, whether it's affecting other parts of your body. You get perspective from experts in different oncology disciplines, such as medical oncology, radiation oncology, and surgical oncology. You get the identification of any other treatment options that might be available to you. You'll get information about what clinical trials might be available for you. You may even be able to prevent unnecessary surgery or unnecessarily invasive treatment. You'll get an improved understanding of your diagnosis and of your treatment plan. There's the possibility, high possibility, of discovering new treatments, no matter how long you've had cancer or what stage you're at. And overall, you will have more peace of mind and a better outcome. These agencies support second opinions because they've been proven to increase treatment success. In fact, studies show that when a patient gets a second opinion, more than 25% of the time the initial diagnosis is completely wrong. Additionally, when a second opinion is presented to the original physician, more than 70% of the time the initial treatment plan is modified to incorporate new information. Our statistics actually show those numbers are much higher. We have a track record of well over 95% of the time finding additional treatment options that we can prove will have better benefit for you, that your oncologist will prescribe for you. In fact, cancer treatment options and management is the gold standard of second opinions around the world. When it comes to cancer, due to the high specificity and validity of the genetic testing and detailed imaging scans and the personalized research we provide your physician, well over 95% of the time, oncologists amend their original treatment plan to incorporate our new data. This means that you get the best of both worlds. You don't have to change doctors, and you get a more targeted treatment plan. The bottom line, your oncologist wants you to have the most successful outcome to your cancer treatment as possible. That's why they got into oncology in the first place, and it's why they're there. The excellent quality of FDA and CLIA-approved tests, research sources, and treatment options that our CTOAM team provides allows your oncologist to readily adopt the suggestions that our team presents. Most doctors will welcome another physician's input. A good doctor understands your right to be well informed and should support a second opinion. So in this presentation, we've talked about all of the elements that are most important for you to make sure are a part of your cancer treatment plan. We've talked about the 4 pillars of precision oncology: PET-CT, genetic testing, personalized research and advocacy, and targeted therapies. We've talked about the importance of a nutraceutical diet in your own personal ability, in your self-care to be able to slow and reverse cancer. We've talked about clinical trials, what they are, and why they're so important for many cancer patients. We've talked about why precision oncology isn't perhaps being offered to you as part of your cancer treatment. And we've talked about what cancer treatment options and management can help you and your oncologist to access, and what that means ultimately for your overall survival, for how long you live, and for the quality of that life. The more rapidly that you add every one of these 7 crucial elements I've discussed with you today to your cancer care, the greater your chances of beating cancer become. Hands down. If this sounds of interest to you, I'm here to share more about how you can access the most current evolutions in medical science, no matter where you live or what type or stage of cancer you have. A second opinion consultation will allow you to get a very personalized review of your case. I'll present you with a detailed list of next steps for you to take to your doctor and to discuss with your family and friends. There's never any pressure to use our service. Our mission is simply to ensure that you know what is possible for your care, that you are as educated as possible about how cancer care works and how you can get the very best treatment that medical science can provide. If you'd like to speak with me for your own personal cancer care strategy session, simply click on the link on this page and you'll be taken to my schedule where you can book in a time with me. I look forward to meeting with you soon.